CT scan abdomen and pelvis of 55 years old female patient, and the study is done without contrast plain images and post contrast images in arterial, portal venous and delayed venous phases. So this is pre-contrast image through the region of pancreas, and here we can appreciate multiple hypodense areas which are almost completely occupying the head, neck and body and tail region, which are suggestive of pancreatic cysts. And in addition to these pancreatic cysts, there is a soft tissue density hypodense mass in the region of pancreas. On arterial phase, we can see that there are multiple non-enhancing cysts completely replacing the pancreatic parenchyma with intervening faintly enhancing septi, and this solid mass in the region of head of pancreas is showing homogeneous contrast enhancement. This is the portal venous phase, and we can better appreciate that this mass is showing central contrast enhancement, while peripherally it is showing contrast washout. And these pancreatic cysts are more evident by relatively more enhancement of intervening septi. So we can better appreciate the bulky pancreas which is completely replaced by pancreatic cyst and a mass in the region of head of pancreas. So this is the delayed venous phase, and we can see the excretion of contrast through kidney. And now the cysts have become more evident because the intervening septi are more enhancing as compared to the previous phase, and we can now better appreciate multiple pancreatic cysts, and this pancreatic head mass is showing clear cut peripheral washout and with persistent central contrast. So this suggests that this is a hypervascular mass which is showing early contrast enhancement and delayed contrast washout. Another finding which we can see in this study is there is a soft tissue density solid mass in the region of right adrenal, just above the upper pole of right kidney, and right adrenal is not separately visualized. So this is right adrenal mass. This is arterial phase, and in this arterial phase we can appreciate this mass is showing peripheral rim enhancement, and centrally we can see the irregular minimally enhancing in a component in the center of this mass. On portal venous phase, we can see there is relatively more enhancement of contrast in the center of the mass. And on delayed venous phase, we can see that there is more homogeneous enhancement of contrast which is occurring progressively towards the center of this mass. So this mass is not showing delayed washout, which suggests that it is not as hypervascular as we have seen the mass in the region of head of pancreas. In addition to pancreatic cyst and the mass in the region of head of pancreas and right suprarenal gland mass, we can see that there are multiple cysts of variable sizes in both kidneys, and some of the cysts are very clear with no intervening septic, calcification or solid component, and these are Bosniak type 1 cysts, which are simple renal cortical cysts. But in addition to these Bosniak type 1, we can see there is a cyst in right kidney which is showing thin intervening septi which are showing minimal contrast enhancement. Another cyst in right kidney is showing a solid enhancing component in it. So this is Bosniak type 4 cyst, and the other cyst which we just saw with thin intervening enhancing septi is Bosniak type 3. So constellation of these findings, which include pancreatic cyst, mass, hypervascular mass in the region of head of pancreas and right suprarenal mass, and Bosniak type 3 and type 4 renal cysts, is suggestive of a very rare syndrome which is called von Hippel syndrome, and this syndrome also includes multiple hemangioblastomas in brain and spine. So this patient is suggested for further evaluation by screening MRI brain and spine. Right suprarenal mass may be a pheochromocytoma. For this, urine VMA levels are suggested, and history of hypertension should be taken, and further evaluation by screening MRI brain and spine with the lab and clinical history will confirm the diagnosis.